Dr. Emily Wang, who is an assistant professor at the Yale School of Medicine and co-founder of the Transitions Clinic Network. Dr. Wang's research focuses on promoting health equity for vulnerable populations, especially individuals with a history of incarceration, through both prison and community-based interventions. The topic of our webinar today is the impact of a provision of federal welfare law that bans people with felony drug convictions from receiving TANF, or welfare benefits, and SNAP, or food stamps. Marc co-authored a report published by the Sentencing Project last month, finding that the felony drug ban has a disparate effect on women, children, and people of color. There are now 180,000 women in the 12 most impacted states who may be affected by the TANF ban. First, Marc will go over the major findings of the report on the TANF ban. Then, Emily will present her research on the public health implications of food insecurity and the SNAP ban on formerly incarcerated people. And finally, Marc will close by discussing the current political climate for reform and some strategies for challenging the felony drug ban at state and federal levels. The webinar slides, as well as a recording of the webinar, will be available online after the webinar. There will be a question and answer session after the presentation, and you can either call in your questions or you can submit them electronically through the webinar interface. We recommend writing down your questions as you think of them and submitting them at the end, because oftentimes questions that you have earlier in the presentation might be answered later on. And just a reminder, if you're typing in a question to us about a specific slide, please reference the title of that slide just so we can make sure to answer your question. So without further ado, Marc, if you want to go ahead and start us off.
Sure. Thanks so much, Jane, for the introduction, and thanks to all of you who are on the call today. This issue today is something that's been of concern to the Sentencing Project for quite some time, which led to the research that we did just last month. And so we want to look at the background of this issue, the research that we've done in this area, and look at the implications for policy going forward from here. So we start with the federal ban itself. What we want to look at in the webinar is an overview of where the ban comes from, the possible goals that policymakers had in mind when they implemented it, what we believe the implications are for reentry, recidivism, public health, current political issues around that, and where we think we should be going in terms of public policy around this issue. So the felony drug ban grows out of the 1996 welfare reform legislation in Congress. That was a major bill, major initiative of President Clinton. A very small provision of that inserted a ban on lifetime receipt of welfare benefits or food stamps for anyone with a felony drug conviction. Basically, the ban was put into effect, but states had the option of opting out of the ban if they chose to do so, but they had to affirmatively opt out of the ban to not participate. As of today, 37 states are fully or partially enforcing the ban on TANF benefits, welfare, 34 states enforcing the SNAP ban, food stamps. Now, of these states in each category, 25 of the states, not always the same ones, have modified the bans somewhat, and the modifications take different forms. In some cases, states have said that if you have a felony drug conviction and you're enrolled in treatment, you can receive welfare benefits or food stamps. If you're not in treatment, you won't be. In other states, the policy has been if you had a conviction for drug possession, you can receive benefits. If it's drug selling, you can't receive benefits, is how that's played out. So many states have taken some action in looking at this issue at how they want to apply the ban. So the research that we've done recently looks at the impact of the ban since 1996, and we took data going for a 15-year period going through 2011. We looked in our research at the 12 states that are currently enforcing the felony drug ban on welfare benefits, or TANF, in full. So in other words, these are states that have not opted out either completely or partially, are enforcing the ban in full. And you can see on your screen which are those states that we've looked at. Our estimates are that women in these states, there are an estimated 180,000 women who have had a felony drug conviction at some point in this 15-year period and are therefore subject to a lifetime ban. Now, just to be clear about what this number represents, this does not mean that 180,000 women today are not receiving benefits because of this. Some of these women would not qualify because their income is above the level for receipt of benefits. Some of them do not have children. A variety of factors might explain why these women are currently not banned because they don't qualify, but they represent the pool of people who at any point in their lifetime when they might be in need of welfare benefits would be rejected because of the federal ban. We should also say the 12 states, the 180,000 figure, is a very conservative figure as well. First of all, we didn't look at men in the study, and while most recipients of TANF benefits are women, a non-trivial proportion are men as well. Secondly, we didn't look at the 24 states where there's a partial ban and try to estimate what those numbers might be. The reason we didn't do that is just methodologically too difficult to be able to really do that in the partial ban states. But this gives a snapshot of what that impact may look like as we look around the country. Now, if we look at the impact of the ban on women and children, for a number of reasons, it's not at all surprising that this has a very disproportionate impact on women and their children. For a start, as mentioned, the vast majority of people receiving TANF or SNAP benefits are women. If we look at the impact of the war on drugs, we've seen some very significant changes for women since the mid-'80s when the war on drugs really started to ramp up. Now, the reason for that essentially is that women have always represented a relatively small proportion of people in prison, especially for drug offenses, for violent offenses. Women are just not as engaged nearly to the extent that men have been for a whole variety of reasons. As prison populations started to shift with the drug war, it became more likely women would go to prison because women had a greater likelihood of being involved in a drug crime than they did a violent crime. So that became more of a factor in incarceration. It almost inevitably brought more women into the system, women with drug offenses. Also, the dependent children of these women are affected as well. The children obviously have not committed a crime, are not directly affected, but the way they're affected is that if you have, say, a 3-person household, a single mom with 2 kids, the mother would lose her benefits. The 2 children would still remain eligible for benefits, but essentially, rather than getting benefit level for 3 persons in the household, it's reduced to 2 people. So with benefit levels in many states quite modest to begin with, this can have a very significant effect by reducing those numbers. The racial disparities brought about by these policies are probably not surprising either if we know the history of the war on drugs and how that's played out. We've seen from a broad range of research that while rates of drug use and abuse are relatively similar across racial ethnic groups, that law enforcement practices have very disproportionately brought in people of color into the justice system for drug offenses. So we see disproportionate impact of the war on drugs, bringing people of color into the system. We also combine that by seeing higher rates of poverty among communities of color as well. Therefore, policies based on low-income status and a drug offense, again, almost inevitably, we're going to have an effect on people who are affected by this felony drug ban. And I should note there was virtually no discussion about any of this at the time that the law was put into effect. Now, if we want to measure the impact of the policy on its purported goals, on the one hand, it's very difficult because there was literally 2 minutes of debate about the policy at the time the amendment was enacted in 1996, 1 minute for Republicans, 1 minute for Democrats. And so there was not exactly a strong rationale that was portrayed in this. But in writings and some court work since then, it seems that the two potential goals that one might argue would be accomplished would be, one would be deterring drug use, and secondly, reducing welfare and food stamp fraud. So what do we know about that? Well, if the idea is to deter drug use, the sort of common sense explanation would be, well, if we take drug offenders and we send a message to them, this policy can help to reduce use because they may fear the consequences. Well, there are many problems with that approach. First of all, if you look at the people convicted of a drug offense, more than half of those felony convictions are for selling drugs and not using drugs. Now, there are some people who sell drugs in order to support their own drug addiction and they're drug users. There are also many people who sell drugs who don't use drugs themselves but merely do it as a means of making money. So they're not using drugs. That's not the problem in that case. Similarly, there are many people convicted of other offenses, robbery, burglary, larceny, all sorts of things, who are committing economic crimes, property crimes, in order to get money to buy drugs to support their own addiction. But those people are clearly not covered by this policy either. So it's both over-inclusive and under-inclusive if one really thinks that we could deter drug use by doing this. You know, some might make the argument that if you know there's a threat, you would lose access to these public benefits. If you're convicted of a felony drug offense, this would have some deterrent effect in itself. It's hard to imagine that that could be a very substantial effect over and above the punishment that you might face, punishment of a prison term potentially for committing this crime. It's hard to imagine that the threat of losing welfare or food stamp benefits would produce any more substantial impact on that. The idea of having the policy in order to reduce fraud similarly doesn't seem to hold up very strong. We know from a good deal of research fraud rates are not very high to begin with in accessing these benefits, and therefore we're throwing out huge numbers of people from having access to these benefits on the idea of trying to catch a relative handful of people who might be engaged in fraud. At the same time, we already have mechanisms in place that can punish fraud, that can detect fraud, and the like. So it certainly seems like it's hardly a very effective way to get at a problem like that. Now, in terms of what the implications are of of these policies, these can potentially be very harmful, particularly if we're looking at reentry issues. And in this regard, it's somewhat ironic and very disturbing, I think, that just as there's been a national movement to support reentry initiatives beginning in the late 90s, very broadly embraced today, the felony drug ban really strikes very directly against everything we know about what people need to support themselves in that difficult time, the transition time coming home from prison. SNAP benefits, TANF benefits essentially are designed so that person gets out of prison, they're able to get a job, they're able to support their kids, and 6 months later they get laid off from their job and would ordinarily need some temporary support to get through that period until they can gain employment again. And here what we're saying is that when you get into that position, there's no more safety net available. It doesn't mean that everybody in that position will go out and start committing crimes, but certainly we're increasing the risk, increasing the odds of that possibility if we deny them these very basic kinds of survival mechanisms. So in terms of public safety, in terms of encouraging reentry, this can be a very harmful policy overall in terms of what that produces. So at this point, let me turn this over to Emily Wang, who's done one of the most significant studies to date looking at the possible impact of denying these benefits and how that plays out with the potential recipient. So, Emily?
Great. Thank you, Mark. I just wanted to say good afternoon and really thank everyone for participating in this webinar. It's just a great opportunity and look forward to hearing your feedback about our work. So it's in that context and in that milieu as a physician and as a researcher that cares only for individuals returning home from prison that we became interested in this question of whether or not food insecurity, not having access to good quality food, was associated with increased risk for bad health outcomes. And there's a number of patients that come to mind that would come to our clinic having just been released from prison, struggling to meet their basic needs, and similar to what Mark had indicated, found themselves in positions where they were turning to risky behavior. A woman in particular started returning back to sex work. So certainly a health risk to herself, to her family, and arguably public safety. And so we endeavored to answer a question of whether or not food insecurity is associated with HIV risk behavior among recently released inmates. This association has been studied in international settings, and it has been found that, simply if individuals don't have access to food, they're likely to engage in high-risk activities that put them at risk for HIV. And you can imagine that in this patient population, when individuals are moving from prison back to the community, they're at risk for new incident food insecurity. So they've gone from a setting where they had 3 meals a day to one where they obviously have to access and acquire food on their own. And certainly, as many of you know, individuals that have been released from prison are at higher risk for engaging in HIV risk behavior, as well as potentially even transmitting HIV. And so we were interested in studying this question in the United States, and as it hasn't been studied before, really wanted to get at the issue of whether or not differential access to food stamps, given this ban, TANF ban, led to worse food insecurity. And so we piloted a study, a cross-sectional survey of 110 recently released individuals in 3 different states that have different food stamp bans. And so in Texas, as Mark indicated, they have a lifetime ban, and in California they have a partial modified ban, which is a bit stricter, where individuals have to first complete 6 months of drug treatment, document that they've completed it, and thus can regain access. And then Connecticut, where there's essentially no ban on food stamps, surveyed individuals within 12 months of release and really tried to ask measure whether or not they were food insecure and whether or not they were engaging in HIV risk behaviors. We did so in partnership with a community organization, All of Us or None, whereby we hired individuals to become research assistants who themselves had experienced past incarceration, in essence, hoping to improve the accuracy and validity of our measurements. Individuals that had been released from prison before knew how to engage patients that had just been released from prison into this study, given all the barriers to engaging former prisoners into studies, and so used this community-based participatory research in our study design. Next slide. And so these are some of the findings, some of the main findings. What we did find was that first, and I think that this is a surprise to us all, that 91% of the individuals that we surveyed met criteria for food insecurity since being released from prison. These are, we used the same definition as the United States USDA does in terms of measuring food insecurity, and found that 91% met the USDA's criteria for food insecurity. These are rates higher than most all developing countries, certainly higher rates than low-income individuals in the United States. We also found that 37% reported having had a full day in the past month where they just didn't have enough money to eat. And only 52% actually received food stamps. On average, the food stamp benefit was $200, and it didn't last the full month. Next slide. And in terms of our main findings, so in looking, we looked to see whether or not there was an association between hunger, so those who didn't eat for an entire day, and HIV risk behaviors. And this is a complicated slide, but just to walk you through the tables, and the leftmost column, those who didn't eat for an entire day, what you can see is that, for instance, 78% of those who didn't eat for a whole day among those who reported having sex had used alcohol prior to intercourse, compared to 36% who ate at least once every day. And you find the similar patterns in looking at the other HIV risk behaviors, including using cocaine or crack prior to intercourse. Again, those who didn't eat for a full day were more likely to engage in that risk behavior compared to those who are eating every day, as well as using opioids prior to intercourse, and like our patient, were more likely to either pay for or be paid for sex work compared to those that were eating for an entire day. These associations were statistically significant. Next slide. And so the public health conclusions we can take from this this pilot study are that food insecurity is incredibly common among individuals who are newly released from prison. Again, they're at higher rates than any international setting that's been documented, and higher than most low-income individuals, communities in this country. We found that not eating for a whole day or being hungry is associated with high-risk sexual behaviors. And we also found that individuals who live in states with a food stamp ban, so this was Texas and California, were more likely to go hungry compared to those who live in states with a minimal or essentially non-existent ban in Connecticut. And so what we conclude from this, again, is that certainly more research needs to go into the public health implications of this policy. You know, it's not enough to say that, you know, again, in this study of 110 individuals, that the ban in and of itself is leading individuals to high-risk behaviors, but certainly what it can show is that these individuals that have been newly released from prison are at high risk for food insecurity, and that not eating for a whole day is associated with increased risk for HIV.
Okay, thank you so much, Emily. To look at where this brings us today, as we mentioned, there are currently 12 states that are enforcing in full the ban on TANF, 9 states enforcing in full on SNAP or food stamps, and then roughly 25 additional each category, the partial ban. So it's a very widespread ban. It's not as widespread as Congress may have intended, but nonetheless, very substantial numbers of people subject to its provisions. As if that were not bad enough, in recent months, there are now proposals in Congress to extend the ban as well. The Farm Bill that's been working its way through Congress in the last several months, and as you know, the Farm Bill includes the food stamp program as well, and Senator Vitter of Louisiana has introduced an amendment to the Farm Bill that would extend the ban on food stamps to anyone convicted of a number of violent offenses as well. So extending it from the felony drug ban to include violent offenses as well now. It's the whole politics of the Farm Bill are very much up in the air at the moment. As most of you know, there's been a great deal of partisan battling over this. The Vitter amendment received an overwhelming bipartisan support in the Senate. How this will play out as the two houses, if they come to some agreement, if there's some compromise going on, we don't know. There's activity going on now to try to educate members of Congress around this, but this could really substantially increase the numbers of people who are affected by this policy, very much in ways that we saw back in 1996. So this brings us to where we would like to see public policy moving ahead here in a more constructive direction. The ban has been in effect for 17 years now. To date, there's no research we've seen that's been commissioned by anyone on Capitol Hill or anywhere else that can demonstrate that the ban has met some important public safety goals, whether it's regarding drug use, whether it's regarding the health of the food stamp programs or the like. And so a sort of feel-good measure passed in 1996 that's potentially affecting many people's lives, potentially affecting their reentry prospects. One would ordinarily think there might be some interest in looking at the effects, and yet we have nothing to suggest that it's having positive effects, and we have great reason to be concerned about it. So where we think we should be moving in public policy is that ultimately this ban comes from Congress, and to deal with the problem, we would like to see legislation proposed and adopted that would repeal the ban because it's not serving any positive social goal, and it's potentially harming recidivism and reentry issues quite substantially. Until such time as that may happen, it's very important to try to be working at the state level. We would certainly recommend that there be campaigns to try to encourage states to opt out of the ban completely because of its effects. At the very least, a partial opt-out of the ban clearly would then affect fewer people than the full opt-out that we've seen in other states. And as we know, there's been a good deal of activity, most of it in the several years after the legislation was originally adopted. It's certainly time now to try to revisit those policy debates. I think in every state, which is roughly the 3/4 of the states that are still enforcing the ban in full or in part. So that's where we stand on the policy issues now. We undertook the research in order to try to examine the effects of the policy to date. What we find is not very encouraging. It's very disturbing in terms of potential impact that we have found and Emily Wang has found through her research, and we hope that this can stimulate discussion and advocacy both at the national level and at the state level as well on this issue. So at this point, I think Jean is fielding questions. If there are any questions for one or both of us, we would be pleased to respond or to hear your comments about this issue.
Thank you, Mark, and thank you, Emily, for your presentation. At this point, yeah, I'll be fielding some questions. You can either submit questions electronically using the questions tool on your screen, or if you raise your hand by clicking the little hand symbol, if you would like to ask your question over the phone, you can do it that way also. Just a note, if you do want to ask your question over the phone, just make sure that you're not self-muted so that everyone can hear you. And also, in order to be heard, you'll have to have submitted your audio pin, which should be on your screen with the red background. So just that note. There is a question that's been submitted electronically by Andre Staffington, which says, is there data available to attendees or even the general public on their particular state? And Andre is curious about the state of Ohio.
No, we just have data on the 12 states that enforce the ban in full, where we were able to provide estimates by state. Any states that are not included in that, we were not able to try to come up with the estimates on what that looks like. And again, it just has to do with the data availability, and it's just very difficult to get that information. I will say for Ohio in particular, actually though, that state has opted out of both parts of the ban, both TANF and SNAP. So congratulations to policymakers in Ohio, and it's not currently an issue there. And it was something that other states should look at as well.
Okay. There's another question for Mark, which is, if a person can have his or her felony conviction dismissed or expunged, would he or she qualify for full access to SNAP and TANF benefits?
I'm not an attorney, and so take this with a grain of salt or so, but my understanding is that, yes, that would, by doing away with the conviction, essentially, then a person would qualify for benefits with no questions asked, essentially, just as they would qualify for other things that might have otherwise been denied because of the felony conviction.
Okay. Another question, what organizations are lobbying Congress against the Vitter Amendment?
Well, the Sentencing Project, we've been very engaged. The Legal Action Center has a long history of work on this issue. The Center for Budget and Policy Priorities, some of the civil rights, some of the civil liberties organizations in Washington have been engaged as well. We have some information on our website of the Sentencing Project about the Vitter Amendment. We've submitted coalition letters to members of Congress around this issue. So there's a variety of ways to get involved. Anyone who would like to be particularly involved in this, you can just send us a note through the Sentencing Project website, and we'll be happy to put you in touch with ways that you can help out in this effort.
One participant says, I live in California. What can I do in response to this disturbing information?
Well, as Emily mentioned, California is a modified ban state. You know, I think, again, at the Sentencing Project, we would welcome your inquiry through our website, and we may be able to put you in touch with organizations in that state that are working on this, or what to see what their legislative prospects for returning the ban so that it's not a partial ban but no ban. Emily, you may have some thoughts about California as well, or context there.
Right. So I think that there are some organizations, and probably Mark will have the best information about that. I mean, one thing I think in particular is that Barbara Lee of California has introduced the HR 329 multiple times. I mean, I think it has different names, and it might not be getting the actual policy right, where she has tried on a congressional level to eliminate the ban. And so I do think that there are strong advocates within the state of California. I think it was co-sponsored at one point by Rosa DeLauro in Connecticut, but there are strong advocates within the Senate that, within the House of Representatives and the Senate that are interested. But in particular, Barbara Lee of California has been a real supporter of this.
Great. Ekaterina Burton has raised her hand, so I'm going to go ahead and unmute her. You should be unmuted if you'd like to ask your question, Ekaterina. Ekaterina? Okay. Well, she's typed in and said that she's not on the phone, but she says, I'm from the Alameda County Community Food Bank, and anyone interested in overturning the ban in California can contact me. So she submitted her email address here, and I'll go ahead and send that to everyone in a second. Let's see. Another question. We have several lined up here. One is, are TANF and SNAP benefits affected by housing a relative or spouse that has a drug conviction? In Virginia, I have known of individuals losing their Section 8 housing because their spouses or relatives that had convictions.
Yes, I mean, there are a whole host of restrictions that attach to certain drug convictions or convictions generally, and a drug conviction, can result in limited access to public housing, and it doesn't need to be the individual with the conviction. So if you have an extended family living together and one person has a felony drug conviction, that can affect the housing situation. My understanding is that that would not apply to, say, a food stamp receipt. If you had, again, a single mom with 2 kids and living with grandma in the house, grandma wouldn't necessarily affect this one way or another. It would just be the immediate family that this would pertain to.
Okay. Here's another question. Do you know of any states' sheriff's associations or prosecutors' offices that have supported opting out of the ban, or other more conservative groups that have supported it?
There are some conservative or evangelical religious organizations that have taken a strong position on this issue and been very critical of the ban. Probably the most high profile of those has been Justice Fellowship, which is the social action arm of Prison Fellowship that was founded by Chuck Colson. And Justice Fellowship has been very engaged on Capitol Hill and with their constituency on a whole range of criminal justice reform issues, including this one as well, and organizing at the moment around the Bitter Amendment in particular, and they're located in Virginia.
Great. Let's see. Someone says that there was a September 2013 study from the Congressional Research Service on the drug testing and crime-related restrictions in TANF, SNAP, and housing assistance, and asks if either of you would know what inspired that paper. She clarifies that she doesn't know what the Congressional Research Service is or what its function is. So I don't know if either of you know, but.
Well, the drug testing issue is an important issue, but it's a very separate one from the felony drug ban on benefits. And this is an issue that's been challenged. It's come up in a number of states, particularly in the last couple of years, essentially proposals to test all welfare recipients for drug use, basically, and it's been challenged in a number of ways. So yes, it's an important issue, but it's separate from the felony drug ban on benefits.
Another question is, we've heard Attorney General Holder speak out against mandatory minimums and 3 strikes laws. Do you know what the administration's position on the felony drug ban on welfare benefits is?
I have not heard the administration come out with any statements or proposals around the felony drug ban. It's possible that they might say that since there's currently not a strong bill moving in Congress, that might be why they haven't taken a position. At the same time, the administration, the Justice Department, has been very engaged in a positive way around reentry issues. They put a good deal of program time into trying to support reentry legislation. They have some information about the states that enforce or don't enforce the felony drug ban, but I am not aware that they've taken a position or been advocating to see that repealed, and that would be something that I think interested constituents and advocates might want to ask of the Justice Department or their members of Congress too.
Mm-hmm. Another question is, Mark, did you say that the study of the impact of the TANF ban on men would be trivial because men do not count as a statistically significant portion of TANF recipients, or did I misunderstand?
No, I think I said non-trivial. That's what I meant to say. Essentially, men are roughly 15% of recipients of TANF benefits and roughly 25% of the food stamp benefits. So, proportionally, obviously, it's less than the rates for women. But since so many more men are in the criminal justice system, either with convictions or incarceration, even those figures of 15 or 25% can add up quite substantially. So again, we didn't try to produce estimates for the number of men affected, but it's likely that those would be substantial figures as well.
Okay, one last question. Are organizations Beam Global Initiatives Incorporated and Southeast Ohio Offender Reentry Coalition would like to partner with the Sentencing Project through a memorandum of understanding among the organizations? How do we go about establishing such partnerships?
Well, I think send us a note through our website, which is sentencingproject.org. We work with a broad range of state and local organizations. It's not generally on a formal basis, but we have good relationships, and try to make those relationships work out that in ways that are mutually beneficial, and ways that we can be supportive of reform efforts at the state or local level as well.
Okay, we actually have one more question. Mary Getty says, I am surprised that Texas still has a lifetime ban given that state's leadership on reentry issues. Any insight as to why that ban has been maintained there?
Not particularly. Yes, there's been bipartisan support in Texas for moving ahead on reentry, and there's been some high-profile leadership on the issue there as well, and I think that's been very encouraging. I think the problem with the ban, and not just in Texas but elsewhere, it can be very easy to adopt some very punitive legislation. Again, as we mentioned on the welfare ban, in 1996, there was literally 2 minutes of debate on the Senate floor before this was adopted. 2 minutes, and here we are 17 years later trying to document the effect of this and what this means for the tens of thousands of people who are harmed by it. So it's always much more difficult to undo a harsh and overly punitive law than it is to get it adopted in the first place. I don't know the particular political dynamics in Texas around this issue, whether there have been any movement to try to address this and try to gain support, but I think the caller is certainly right that if the state wants to continue a commitment to reentry, this is a real stumbling block in making that happen, and it certainly seems it's long past due for legislators to reconsider this policy and take a fresh look at it.
Okay. I think one participant, Sharif Muhammad, had wanted to ask a question over the phone, perhaps. I'm not sure. But let me just see if I can unmute you.
Hello?
Yeah, we can hear you.
Okay. Hi, Mark, and
How are you
hi, Virginia. I want to know, is there anything going on in Florida, particularly with SNAP and reentry into society, dealing with the health care, food stamps, housing, those type of things?
You know, we're based here in Washington, D.C. Emily's up in Connecticut. I don't know for sure what the current level of activity is in Florida. I know there's obviously a broad range of social service groups and civil rights groups that are active in a range of issues there. Florida is one of those states that's in the middle. They have a partial ban on the TANF benefits and a partial ban on food stamps too, and I don't know what the experience is, how that's worked out in practice there. But again, we'd be happy to try to put you in touch with organizations closer to the ground there that may be able to give you a better sense of what that looks like.
I have one more question.
Sure.
I would also invite my services. I have a PhD in organizational behavior and management to help with this problem.
We welcome help wherever we can get it around the country. These are big issues, and we need all the help that we can get. So, yeah, by all means, please be in touch with us.
Okay, I will. Thank you, and thank your guests.
Sure. Yes, thank you. Okay, well, I think that's the end of all the questions. If you happen to have a question that you didn't get to ask or think of something later, please feel free to email us at staff@sentencingproject.org. We will be posting the webinar slides as well as a recording of the webinar online, and all of the participants should be receiving an email with all of the information on how to access those things in the next couple of days. So thank you, Mark. Thank you, Emily, so much for your presentations, and thank